that's critical. Maybe not even critical. It's almost like existential, right? Because if we don't do this, we are at such a crisis with so many physicians from their own mental health. Like you said, the repetitive stress injury on physicians, moral injury, as some refer to it. But if we don't focus on this, I think there's really risk of losing. We already have lost so many colleagues, just the stress of the injury and repetitive injury and the experience in COVID. But even beyond, what happens to healthcare when physicians aren't there? We know that's not a good story. It's not a good ending, and it's already happening in certain parts of our country. So I think that is just critical, almost really existential if you're thinking about the existence of physicians.
Now,
And
what are your
so,
thoughts on, you say lessen the burden on physicians, okay? You bring technology to lessen the burden on the physicians. What do you think about when the physician doesn't want that burden to be lessened because they're so ingrained in doing things their way? That's the way I've always done it.
Yeah,
You just can't get out of their own way. For example,
right.
let me give you an example of one, okay? Herb had this brilliant idea of we should send videos to the patients before they come in for their checkups to explain what's going to happen, give them all that anticipatory guidance, tell them what vaccines they're going to get, the side effects of what they're going to give, send it before the visit, short. And when the patient comes in the room, you ask them, did you see the video? Did you watch the video? Do you have any questions? Then you could do a little bit of just talking about different things, one or two statements just to make it look good. What do you do about that when the doctors have that, yet they don't want to use it? Because
Yeah,
they have to do their spiel. And
right.
I saw so many patients. I'm behind schedule. I went home really late because I had all these checkups. It's like, it blows your mind.